on our talking point tonight, a very special panel. The Health Minister, the man at the center of it all, Ghulam Nabi Azad, also Dr. K. Hari Prasad, CEO of Apollo Hospitals, Hyderabad, and Suresh Kalmani, Member of Parliament from Pune, the epicenter of this swine flu outbreak. First to you, Mr. Azad. The private hospitals are now saying they need facilities, they need isolation wards in place, they need time before they can treat people, but time seems to be of the essence at the moment and people are running out of patience in a sense. What is the government doing now, perhaps to involve the private hospitals in a more effective manner? We've just seen Apollo saying they need more time. Pune hospitals have turned back patients.
Now, let me tell you first of all that we had decided about a week back that we will seek the cooperation of the private hospitals, and the state governments were told, even I talked to the chief ministers across the country and health secretaries, health ministers were asked to be in touch with the private hospitals so that each hospital can identify one special ward especially for the swine flu patients. Naturally, they would require some time because it has to be a totally different kind of ward which has to be disjointed from the rest of the wards. So they need some time.
Absolutely.
But the information which I have got across the country, that almost all the hospitals, private hospitals are cooperating.
Okay, Mr. Azad, I just want to take up this one point. Many would say there is a little bit of confusion. If only you had anticipated this situation and told private hospitals much early on that their help would be required, by now they would be ready, by now those isolation wards would be ready, that air conditioning would be ready, and we wouldn't be facing this situation where private hospitals are saying, look, we can't take in swine flu patients at this moment. There's a bit of a delay on part of the government.
No, let me tell you, there are three categories of patients. The first category is anybody having cough, cold, mild fever, headache, body ache.
Right.
He or she need not to be hospitalized. He and she need not to be even to take the Tamiflu. So that's the one category. The second category, he or she who has the cough and running nose and has high fever and has pharyngitis, he or she is supposed to take Tamiflu medicine,
right,
but have treatment at his or her residence.
Right.
It is only that last category which is having all these symptoms in addition to other ailments.
Right, sir.
Breathlessness, heart disease, lung disease. These patients are only supposed to be treated in hospital.
Sir, point taken. But
no,
you see,
let me tell you. This is most important. But if the category 1 and category 2 people also want to be hospitalized, which have not been advised to be hospitalized, then naturally. So if you are talking about the third category, which I have just now mentioned, they still can be accommodated in the government
they can still, sir, but we are seeing what is happening in Pune. I will come back to you, Minister, in a moment, because I want to first get from Dr. Hari Prasad what Apollo did today. Dr. Hari Prasad, I have your final statement here, where you say that you will be ready to provide treatment to patients, to swine flu patients, once your isolation wards are ready, but more importantly, once the government has given the appropriate directions. Here you have the minister saying, the health minister saying that a week ago, private hospitals were brought on board. How do you then explain the fact that you seem to believe that you're still waiting for clear directions from the government?
Yeah, Rajdeep.
Yes.
Let me first reiterate the fact that Apollo has never refused to treat H1N1 patients. It is just that we refuse to do it on a campus where patients already exist, and it becomes our responsibility to protect the patients who are already in the hospitals from any risk of being infected by the H1N1 virus.
Okay.
That has been the stance of the hospital, and Apollo has responded at every point of time over the last 27 years whenever the nation needed us. And here we are again at the forefront, and we will respond to any requirement on the national front. And the second issue is swine flu is new. It's not a disease which existed. It's a new disease. All of us need to understand more about it and need to know more about it before we are able to actually provide the care.
Have you got clear directions from the government? Have you got clear directions from the government in that regard?
We are in very close touch with the government. We both at the union level and at the state level. We've been talking to them. They've been advising us, and creating infrastructure for swine flu is a time-consuming process because we need to create the isolation rooms.
Right.
It's not just creation of another ward. We need to create an isolation ward which is appropriate for handling these patients. And it is time-consuming.
Okay, you're saying it's time-consuming. Mr. Suresh Kalmadi, Mr. Ghulam Nabi Azad, you're the politicians. If it's time-consuming, for example, Mr. Kalmadi, you have this enormous network across in most other fields, but here you are, the member of parliament from Pune, and yet you're not being able to convince the 8 designated private hospitals from taking patients. Many of them, after the Ruby Hospital incident, simply don't want to get involved.
Well, Rajdeep, nearly 13 hospitals have volunteered, private hospitals, and 2-3 of them have started today. The rest will start in a couple of days. Ghulam Nabi ji has done a great job. He sent a whole team of doctors.
As a result, you're saying 2-3 days, but at the moment there's overcrowding in just 2 hospitals, Sassoon and Naidu in Pune. And that's where the problem is coming. The entire pressure is on 2 hospitals in a city of the size of Pune.